Hi, my name is Grismel, and this is the chapter 25. Mental illness, psychiatric disorders. Psychiatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest from a dementia is that associated with old age, senile dementia. Disorders is in which there is no obvious pathologic or anatomical change in the organ are termed functional. These are described below. Substance abuse. Abuse of substance means using it in a way that is harmful. The commonest form of substance abuse are alcoholism and drug abuse. Affective disorders. Here is an extract from a medical textbook. After a mood are similar in meaning and refer to emotions, for example, happiness or sadness. Affect tends to be used for temporary emotions and is spread through manner of speaking, facial expressions, or behavior. Mood is used to refer to a more permanent emotional state. The most common form of affective disorder is depression, the symptoms of which are poor appetite or significant weight loss, sleep disturbance, for example, insomnia, inability to sleep, fatigue, loss of energy, psychomotor agitation, excessive movement and thought, or psychomotor reductions, slowing of movement and thought, loss of interest in similar activities, decreased ability to think and concentrate, feeling that one is of no value to others or that one has done something wrong, recurrent thoughts of death or suicide. 5 or possibly 4 of the above symptoms occurring nearly every day for at least 2 weeks continue a major depression. Neurotic and stress-related disorders. An example of neurotic disorders is obsessive-compulsive disorder. An obsession is an idea that is so persistent that it interferes with a patient's life. A convulsion is an obsessive idea that forces the patient to act even though they recognize that is unnecessary. A common form of this is compulsive washing of the hands. Stress is a feeling of being unable to cope. It can lead to anxiety or fear of problems. A sudden attack of anxiety is called a panic attack. Other types of functional disorders. Theirs include behavioral syndromes associated with physiological disturbance, such as eating disorders, disorders of adult personality and behavior, for example, personality disorder, mental reduction, delayed mental development, schizophrenia and other disorder is which there are delusions, false beliefs. Now I read the chapter 25 in Spanish. Enfermedad mental. Trastornos psiquiátricos. Los trastornos psiquiátricos se pueden dividir en orgánicos y funcionales. La demencia es un trastorno mental, trastorno debido a una enfermedad orgánica del cerebro. La forma más común de demencia es asociada con la vejez, demencia senil, trastornos en los que no existe una patología evidente de cambio anatómico a un órgano o un órgano se denomina funcional. Estos se describen a continuación. Abuso de sustancia. El abuso de sustancia significa usarla de una manera dañina. Las formas más comunes de abuso de sustancias son el alcoholismo y el abuso de drogas. Trastornos afectivos. He aquí un extracto de un libro de texto de medicina. El afecto y el estado de ánimo tienen un significado similar y se refieren a las emociones, por ejemplo, expresadas felicidad o tristeza. El afecto tiende a usarse para emociones temporales y es a través de la forma de hablar, la expresión facial o el comportamiento. El estado de ánimo se usa para referirse a un estado emocional más permanente. La forma más común de trastorno afectivo es la depresión, cuyos síntomas son falta de apetito, pérdida de peso significativa, alteración del sueño, por ejemplo, insomnio, incapacidad para dormir, fatiga, pérdida de energía, agitación psicomotora, excesivo movimiento y pensamiento o retraso psicomotor, ralentización del movimiento y pensamiento, pérdida de interés en actividades estimulantes, disminución de la capacidad para pensar y concentrarse, sensación de que uno no tiene valor para los demás o que uno ha hecho algo malo, pensamientos recurrentes de muerte o suicidio. 5 o posiblemente 4 de los síntomas anteriores que ocurren casi todos los días durante al menos 2 semanas constituyen una depresión mayor. Trastornos neuróticos o relacionados con el estrés. Un ejemplo de trastorno neurótico es el trastorno obsesivo compulsivo, una obsesión de una idea tan persistente que interfiere en la vida del paciente. Una compulsión es una idea obsesiva que obliga al paciente a actuar aunque reconoce que es innecesario. Una forma común de esto es el lavado compulsivo de las manos. El estrés es una sensación de no poder hacerle frente. Puede provocar ansiedad o miedo a los problemas. Un ataque repentino de ansiedad se llama ataque de pánico. Otros tipos de trastornos funcionales, estos incluyen síndromes conductuales asociados con alteraciones fisiológicas como los trastornos alimenticios, trastornos de personalidad y el comportamiento de los adultos, por ejemplo, trastornos de la personalidad, retraso mental, retraso en el desarrollo mental, esquizofrenia y otros trastornos en los que hay delirio, falsas creencias. Now I read the exercise 25. 25.1. Complete the table with words from A, C, D, and E opposite to happy. Noun, affect, adjective, affective, annexious, behavior, behavioral, dementia, demented, disturbance, disturber, suicide, suicidal. 25.2. Make word combination using a word from each box. 2 words can be used twice. Look at B, C, and E opposite to. Behavioral, hearing, major, mental, personality, psychomotor, sleep, substance abuse, disturbance, reduction, disorder, depression, syndrome. Behavioral syndrome, hearing disorder, major depression, mental reduction, personality disorder, psychomotor reduction, sleep disturbance. 25.3. Complete the sentence. Look at A, C, D, and E opposite to help you. 1. The way a person behaves is his or her behavior. 2. A persistent emotional state is a mood. 3. A sudden attack of anxiety is a panic attack. 4. The form of dementia associated with aging is called senile dementia. 5. A disorder which is not associated with pathological change is functional. 6. An idea which forces a patient to repeat unnecessary action is a compulsion. 25.4. Which symptoms of depression was this patient suffering from? Look and see opposite to happen. Case 41. A 56 years old woman presents to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. The patients have 3 of the last symptoms to illness: loss of interest, sleeping poorly.